Hi everyone, I'm Stan Mallon. Welcome to Paranormal Yacker. My guest in today's show, critical care physician Dr. Adam Rizvi, has witnessed countless moments of transition in the ICU that science alone cannot explain, and he has written about them in his book, Love Does Not Know Death. In the book, which is sure to inspire and uplift those who read it, Dr. Rizvi writes with passion and compassion about his experiences, and he does it by relating factual stories of death, dying, and the miracles of true forgiveness. Dr. Adam Rizvi, welcome to Paranormal Yacker.
Thank you, Stan. It's a pleasure to be here.
You, Adam, write about extraordinary moments around death. Can you describe one that deeply affected you and the reason it affected you as strongly as it did?
There's been so many. It's a good question. What I'll say is around the moments of death, I've noticed a whole string of synchronicities. It happens often. And for those of you who've lost loved ones listening, you may have had something similar. Sometimes it's small things like a loved one who's on their deathbed, you tell them, I'm just going to go use the bathroom. I'm going to go grab some soda from the vending machine. I'll be right back. They step away, and in that moment, they die or they pass away. The timing seems so synchronistic. There have been countless moments where I have noticed a patient who should be dead, multi-organ failure. They're on life support. Their kidneys have shut down. Their heart's barely functioning. They're on so many strong blood pressure medications to keep their blood pressure up. And we're waiting for a son or a daughter or a spouse flying in from out of state. As soon as they come to the bedside, and hold their hand and they're there in person, that's when the person dies. And it just blows my mind every time because it just can't be chance. It happens too often, these sort of synchronicities. And then I'll share one, which I shared in my book, Love Does Not Know Death, is a story of a man named Robert who had a pulmonary disease, a lung disease. The specific condition was obstructive pulmonary disorder, COPD. He was waiting for his son. He ended up passing away right before his son happened, but the synchronicity wasn't with his son, it was with something else. I felt throughout the whole time taking care of him a sense of self doubt. And this happens, I feel, a lot more than physicians would care to share. I was wondering, did I do everything for this man? Was there a stone that was left unturned? Did I forget something? I just really was questioning myself. I would often ask my colleagues for support, and yet this man was facing end stage COPD. He was facing the end of his life. He could not talk anymore. He was in a coma. He had a face mask, and it was very clear that he was about to pass away. I had this sense of doubt creep up again. I went into my office, which I often do, and I closed my eyes. I just went inside and I felt that self-doubt. And I just looked right at it and I said, "No, this is not true. You do everything you can as a physician. Adam, you're doing a great job. Keep loving your patients, do the best you can." And I could feel, talking to myself, I could feel the sort of the self-doubt fade away. And I realized it was just that ego part of my mind that was nitpicking and judging. And I heard it, I saw it, and I let it go. And then I could see Robert in my mind's eye, and I started to pray for him. And I said, Robert, I wish you the best. Your son will be on his way. Everything's fine. Everything's taken care of. If you want to go, feel you're free to go. And I just saw him as this brilliant white light, totally unencumbered by the body, expansive and free. And I felt this peace come over me and this sense of joy and compassion for Robert and for myself. Both of us playing our roles, him as a patient, me as the doctor, but both of us just free in that expanse that I saw in my mind's eye. And I was there just for a few seconds when I got a call from the nurse. saying that Robert had flatlined and he had passed away. And I'll tell you, Stan, I've this has happened very, very often where a patient is on the cusp of dying. I'm meditating, if you will, praying, whatever you want to call it, in my office and wishing the patient well, and then feeling some sort of opening and a freedom happen, only to have the patient pass away in that moment. It's almost as if we're working with each other on some level and there's a release and they feel free to go. And I'm not saying I caused it. I'm just saying that there's an opening I think that happens when a healthcare provider, whether it's a nurse, a doctor, anyone, truly loves their patient enough where the patient themselves on some level feels that love and feels the freedom to go.
The book speaks of light, intuition, and the presence of angels. How do you understand these experiences, and what is your take on them?
I don't speak for, I think, a lot of my colleagues. I think most of medicine comes from a place of a materialist standpoint. And just briefly, what I mean by that is the view is that the body is a complex machine, and that machine can be fixed if it breaks down. And we have some tools to fix it in the Western world, but that's it. And then when the body dies, that's the end of life. There's nothing beyond it, there's no afterlife. In my experience, after hundreds of patients passing away and my own subjective experience, I do think there is an afterlife. There is something. And I think fundamentally it comes down to the question is, does consciousness, does awareness exist independent of the body? And I think it does. I think there's a lot of not only anecdotal evidence, but there's a lot of great scientific evidence to suggest that there is some evidence that that continues. I think angels and spirits, spirit guides, these are all just expressions of mind, of consciousness existing independent of the physical. And it can take many different forms. I'm not an expert in any way in the depths of these metaphysics, but I do feel like there are spirits on the other side. There are guides, there are presences, there are angels, and I think they're here to help us. There's likely a whole other world, probably even more vast than the physical world than we see with our eyes and that we can touch and smell. And my experience has been they're with us all the time.
This is a follow-up question to what you said a little while ago about synchronicity. In Love Does Not Know Death, you share a very personal experience you had, one that's another perfect example of synchronicity. That was the passing of your father on the same day of a Course in Miracles lesson. Can you describe the events that unfolded, how you interpreted those events, and how they affected you?
Thank you, Stan. I'm so glad you brought that question up. Losing my father was a catalyst, and it's funny we say losing a loved one. I don't ever feel like I lost my father, actually. He's still with me. I feel him. I dream of him often. He communicates with me often in dreams. So there's no loss there. But which we should say, when my father's body passed away, I was in the middle of going through a series of lessons in a spiritual text called A Course in Miracles. And for those of you who are unfamiliar with it, just really briefly, this is a text written mostly in Christian language and Christian terminology, but the core message of it is a non-dual message, a purely non-dual message, which essentially says there that we are all one. We are all one, not just euphemistically, not just in impression, but truly at the core of the nature of reality, there is only one. And that changes things quite a bit because it has you start to see the world differently. It allows for much more kindness and compassion because the person that you normally would yell at or get upset at is you. That's also you over there. In a sense, it invites me, at least, it invites readers to be much more compassionate and kind. And I think the depths of most wisdom teachings would teach something very, very similar. So I was halfway through a series of lessons, and in that lesson, it had to do with recognizing that there is one of the lessons in that lesson is letting go of all what you thought this world represents And it's so easy for us to get caught up in our ideas of success, attaining this, getting this degree, that car, that house, ideal picture of things. And knowing my father was dying of a heart condition in Istanbul at the time really brought me in touch with what really matters in life. And just as a brief aside, that is why I think contemplating death is not morbid, but a critical part of the spiritual journey of personal growth and awakening. When people confront death, suddenly the pettiness of life falls away. Suddenly the little things that bother us start to fall away, and we start to realize what really matters. Caring for our loved ones, being present for our parent or children, not letting those precious moments go by the wayside, but really embracing them. I suddenly realized that all the worries that I had up until that point didn't matter because my father was going to pass away and I wanted to be with him fully. I wanted to be with my family fully, my sister, my mother. I wanted to tell him that I loved him before he went away. It all of a sudden became super real. And that particular lesson was guiding me. I loosed the world from all I thought it was letting go of all of the things I thought were important and recognizing what really is important. And I find it very fascinating that that is what I was working on when my dad decided to make his passing. And it's almost like it solidified now and forever that particular lesson. And for those of you who are interested, it's lesson 132 in the workbook of A Course in Miracles. It's a really beautiful, beautiful, powerful lesson, about a page or two long, very short. It really forever will be a lesson I go to remember what really matters in life.
In addition to the spiritual insights and teachings from A Course in Miracles, Tibetan Buddhism shaped your view of the afterlife. In what ways, Adams, has A Course in Miracles and Tibetan Buddhism shaped your views of the afterlife?
For those who are interested, this is a great rabbit hole to go down. There's a book called the Tibetan Book of the Dying, which amazingly outlines, in Buddhist terminology, but you can extrapolate, outlines the experience that someone would go through at the time of death. And it's amazing that a book like that exists because it makes you wonder what kind of people had the level of awareness and consciousness to be so cognizant at the time of that transition to be able to convey it and then write it down. That's always struck me. The Tibetan Book of the Dying talks about something called the Bardo, which is in essentially it means the in between, and it speaks to the many in betweens of life, in between jobs, in between relationships, in between thoughts, in between breath, the inhalation and the exhalation, and also in between lives. And there's a whole description of their afterlife. And most importantly, I would say, and I speak to this in the book, most importantly is the need for preparing for death. We don't often prepare for our own death or the death of a loved one. Practically, as a physician, I see many patients who haven't had the very important conversation of, if your heart stops, would you want chest compressions and electric shocks? If you can't breathe, are you okay with being hooked up to a life support machine and having a tube down your throat? This is called your code status. Most families haven't had that conversation. It's scary to have. People don't want to talk about death, but then at the time of impending death, it puts the physicians in a tough spot because we don't know what the patient wants. We look to the family to tell us what they would have wanted. That's just bare bones preparation of death. The Tibetans, and the Tibetan Buddhists in particular, they have a whole practice built around this. The practice called POWA, Phowa, but the concept extends deeper into when you think about the fact that you're going to die at some point, and we all will, what does that do? It, for me, like I said, it makes me more cognizant of the important things in life, but it also makes me realize that life is impermanent. Things are impermanent, relationships are impermanent. And so it creates a sense of appreciation for those around me and the people in my life, as well as the things I'm experiencing. Something as simple as when I'm on a drive and I feel the warmth of the sun on my face, or it's good weather. today, or someone says something kind, knowing that life is impermanent just really allows me to savor those precious moments. There's so much that happens spiritually and internally when we embrace our own mortality. Again, not in a morbid sense, but to make life more meaningful.
Your book affirms that consciousness continues beyond physical death, citing overwhelming evidence and personal reflection. You say even after bodily death, the seemingly separated mind keeps on going and dreaming. What convinced you that awareness persists beyond the body?
Fantastic question. Fantastic question. Well, there have been personal experiences, but I'll speak to the experiences as a physician that I've seen. This has now happened so often that we have a term for it, near death experience, NDEs, or out of body experiences, OBEs. And in the medical field, I have seen many situations of patients who are declared dead. We have strict criteria for death. The cessation of all brain activity and brain function, the cessation of the heart. And typically, when I pronounce someone dead, I go through sort of a ritual and a process. I enter the room, I have a stethoscope, I put the stethoscope on the patient's chest, my hands go on their carotid, and I'm feeling for a pulse, and I listen for breath sounds, and I use my eyes to watch for chest rise to see if there's some inhalation there at all. If it's brain death, we look to see, are there any reflexes or responses to suggest that the brain is still active. And when I don't see that, when we as physicians don't see that for 60 seconds, over a minute, sometimes we wait longer if there's any doubt, then we declare them dead and we have a time of death. I have had patients declared dead return to life and then describe experiences that cannot, in modern medicine, happen. Stories of seeing loved ones and family, seeing various types of lights, being in another realm with many people and beings and trees and mountains. There's all sorts of stories that I've heard and have been reported in literature. And when you consider the fact that if we are to say that consciousness is a byproduct of neurons firing, and we say that the patient's dead, it means neurons are not firing anymore. It means the brain's not functioning anymore. So where are these experiences coming from? How are these experiences being generated by consciousness if theoretically the tool for generating consciousness, the brain, is dead? And that to me is a very strong argument for the fact that there is something that is beyond the death of this physical body. And I have a feeling, Stan, that as the years go on, as the decades go on, the evidence will continue to accumulate for this, and there will be a shift in medicine towards the acknowledgement of consciousness existing independent of the physical body and the brain. But we're not quite there yet.
When it comes to healing, you, Adam, say it occurs by recognizing death's unreality. Could you explain that?
There's a deeper metaphysical to that statement, but just fundamentally, from what we've been talking about, there is no death. We keep on having experiences. This awareness, for those of you listening, the awareness that is hearing these sounds, this voice, that very same consciousness, that awareness keeps on going after the body dies. And it will continue to have other experiences. And that's what I mean by death doesn't exist. It doesn't exist in the sense of total cessation of experience. Experiences keep on happening, but maybe you could reframe the word. And instead of death, we say a change of form. And I've had many, there's a beautiful series of Japanese death poems. There are some books out there in the Zen tradition where a Zen master, knowing that he's going to die or she's going to die, will often pen a poem in the moments before death and capture something of that moment. First of all, it's amazing that most spiritual masters have a sense of when they're going to die and how. And I just think that's amazing in and of itself. But in these Japanese death poems, they will often speak to dropping the clothes, like taking off a jacket or taking off a heavy wardrobe and then moving on to the next phase in their life. And I kind of imagine that's what it's like. You just take off of a heavy jacket and you are able to breathe more deep and live more freely in the next phase of life.
How and why, Adam, do you believe forgiveness transforms fears into peace?
When I'm at the deathbed of a patient, one of the many missed opportunities that I see is a family that is holding on to grievances, holding on to past hurts. Sometimes the pain or the struggle in the family will be so intense that most of the family members are estranged from each other. And again, I think this is grace, this is the miracle of life, but it takes the impending death of a family member to bring them all back together. And this happens very, very often. A father or a mother is dying, and then all the children who've never spoken to each other because of XYZ happening in the past, they all come back and they're forced to reconcile. They would not have agreed to see each other if it weren't for their parent dying. And in those moments, I see the possibility of great healing for their own self and healing for the family. And it's just so painful to see when that opportunity gets dismissed and they choose to hold on to their grievances and they choose to not forgive. Alternatively, I've seen beautiful moments of families that say, you know what, dad's dying. Let's just put the past behind us. Let's forgive. Let's forgive each other. And I see tears and hugging and just decades of pain and hurt wash away with a hug and letting that go. And I will say, forgiveness is one of the greatest healers. One thing I want to say, some people, and I get this very often, well, why should I heal someone for what they did to me? It wasn't right. When I speak of forgiveness, I don't mean forgiveness where you feel like it's a form of charity, where I'm the better person and they're down here and, I'm going to forgive them because I'm the better person. That's not forgiveness. You're holding on to a sense of superiority and you hold on to the grievance, but you're outwardly saying you forgive. True forgiveness is totally letting go of that judgment, of that pain, letting it go, letting the past be the past, recognizing that everyone is doing the best they can with what they know. Everyone is fighting a hard battle. And maybe they couldn't have said things differently in the past. Maybe they didn't know any better. Maybe they went through such a traumatic childhood that all they knew was how to attack you or other people. They didn't know how to say things differently. So I say in those situations, just acknowledge that they did the best that they could with what they knew. And then the last thing I'll say about forgiveness is a gift you give yourself. You don't really forgive someone for them. You're forgiving that person so you cannot have the burden of judgment anymore. When you forgive someone else, it lightens you up. It frees you up. So that's why I love that phrase, forgiveness is a gift you give yourself, because you're doing it for yourself. If for no other reason than the pure selfish reason, forgive the people in your life. And that's probably one of the deepest and most important messages in the book, and why I say love does not know death, because when you forgive, then there's only love. And that's, I think, the most real thing there is.
When witnessing people transitioning from the earth plane to the spirit realm, I'm positive, Adam, you've encountered folks from different backgrounds and belief systems, as well as agnostics and atheists. Did you, Adam, find any significant similarities or differences, how they reacted to their final moments? And if so, could you share them?
That's a very good question. We often judge one another based on our beliefs. I mean, all you have to do is look at the history of humanity to see all the wars that have been fought in the name of religion and spirituality. But when it comes to the fact of death, we're all the same. We're all human. We're all going to die. We all cry and miss our loved ones when they die. We all wish they could stay with us. The sort of pain that we go through as humans when we face death is universal. So in a sense, no matter what the religious tradition, I've seen a Buddhist monk with his monks pass away in the hospital. That was very interesting. I've seen Muslims pray and recite the Quran while their loved one was passing away. I've seen Christians pray, all denominations. I've seen atheists and agnostics. And fundamentally, what I see in those moments is the form may be one thing, the ritual may be one thing, but the core of it is well wishing for another, loving another, compassion for another. And what it looks like is a circle around the bed. It looks like a hand stroking a loved one's hair. It looks like hands holding other hands at the bedside. It looks like whispers letting someone know that they love them and they're free to go. It doesn't matter what tradition you're in. I see the same sort of behavior. We're far more similar than we are different. And it's unfortunate that we look upon the differences, but really the death is the great unifier in a sense, which is why I felt it was a powerful thing to talk about and a great opportunity for healing.
Thank you for that answer. Thank you. Have your experiences, both the personal ones and those you witnessed from others, changed how you approach dying patients and their families today versus how you approached them at the beginning of your career?
Mm. Yeah, that's a great question. I recall at the beginning of my career, I was so wrapped up in whether I was doing things right that I don't think I was as present as I could have been for the dying person, the dying patient, and their family. I was kind. In general, I am. I consider myself a kind person. But I do notice that there was so much self doubt. Was I giving the right medication? Was I saying the right words? We're taught as trainees how to have these important conversations of guiding a family towards choosing the goals of care, whether they want to go to hospice or whether they want to continue, quote unquote, fighting. There was a lot of self doubt. And then it slowly transitioned to becoming more confident with how I did things and being more present to the family, with the family. What changed it tremendously was after my father's death. I had such a challenging experience in the hospital in Istanbul. They only allowed family members to visit 5 minutes twice a day. That's it. We had to come in, talk to our dad, tell him we love him, and then leave. And all that time, I just felt he must feel so alone. He's with people he doesn't know, nurses that may or may not be caring for him. No one's holding his hand. The humanity aspect, the humanistic aspect wasn't there. And then he got worse to the point where he needed to be intubated and a breathing tube placed in. But no one asked us if that was okay. They didn't ask us if we thought that would be okay for him. And this is nothing against the medical system in Istanbul or that hospital. Different people practice medicine in different ways, and there was a cultural barrier too and a language barrier. But it was painful for me. I did get the chance to talk to him and tell him that I loved him and to tell him that we care for him, and if he wanted to go, he could. So I'm grateful for that. But it left me feeling committed to never having another family go through what I went through. And so after my dad's death, when I returned to the ICU and was with families that were facing the death of a loved one, I always sat down at a chair, eye level, so that they knew I was going to spend time with them. I wasn't hovering above them. There's no power dynamic. It's just one human being to another. And I asked them, how are you feeling? How are you guys getting on with all of this? And I truly wanted to know what was going on with them so I could support them. And often I would tell them my experience with my father, and so they knew it wasn't just a doctor; it was another human being who also suffered loss. And I did my best to care for them and coach them through death as best as one can be coached and guided. And I think that's made all the difference. When you experience suffering, generally there's a greater compassion for those who experience the same.
What message would you, Adam, most want my viewers to take away about death and love?
Don't wait. That's my message. Don't wait for death. If you're listening to this, I would say think of something in your life where maybe you're harboring some grievances, someone in your family or friends that maybe you haven't spoken to because of some hurt feelings. You don't need to wait for something terrible to happen or for someone to be taken away by death for you to tell them that you love them. Life is way, way too short to hold grievances for any length of time. we should be very quick to forgive and slow, very slow to judge and to be angry. And so that would be my main recommendation is don't wait. Don't wait. Have every reason to forgive someone. And just remember, everyone's doing the best they can with what they know.
Should viewers of Paranormal Yacker want to buy Love Does Not Know Death, Stories of Death, Dying, and the Miracles of True Forgiveness, how can they do that?
It's on Amazon. You're welcome to go to Amazon. There are other sources. I think it's on Ingram Spark and a few other online sources. And if you're interested in being updated with all the things that I'm doing, go to lovedoesnotknowdeath.com. Please sign up for my newsletter. It will also take you to my Substack, where I regularly post articles on all the things we're talking about today and more. I can share some personal experiences as well, and that's Adventures in Kindness on Substack. But lovedoesnotknowdeath.com is the best way to get a hold of me.
Dr. Adam Rizvi, I thank you for being my guest on Paranormal Yacker. Yakking with you has been a most insightful experience. Thank you.
Thank you, Stan. It was such a pleasure.
Hi, everyone. This is Stan Mallon of Paranormal Yacker. I hope you enjoyed the interview you just watched. So that you don't miss any upcoming shows, be sure to subscribe to my free YouTube channel. To do that, just press the subscribe button on your screen.